Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And we're going to start doing segments on royal plastic surgery because there's always interest in the royals and their plastic surgery. And today we're going to start with Meghan Markle. She's been in the news recently. She's kind of always in the news. I think she's a very attractive biracial girl or woman. You know, she doesn't need a lot of work, and she hasn't done a huge amount of work, but I think she's definitely done some work. And I think the work was done well. I think it made her look more attractive, which is the whole purpose of plastic surgery, not to make you look weird or totally different, but just a prettier, more attractive, younger version of yourself. And I think that's what she accomplished. One of the first things that I think people comment on with Meghan is her teeth. Pretty obvious. She probably did veneers and some work on her teeth. When you see younger pictures of her, she had teeth that had a lot of gaps in them, a little wider, a little smaller, and now she has this really bright, amazing smile. You know, people shouldn't underestimate how much that adds to somebody's look. Not only prettier, but again, younger, just more attractive, everything. So I think it was done well and not overdone, and I think it was a good job. One of the things that's pretty obvious is probably in her 20s or 30s or sometime around, a little bit younger, she did her nose. Rhinoplasty, again, is something that the noses don't naturally shrink, take more contour, the tip doesn't raise, nostrils don't come in on their own. So I'm kind of giving away, but that's what I noticed in her nose. So if you look at her when she was younger, her nose was more bulbous, the nostrils were a little wider, the bridge of her nose wasn't as defined. And then as we move into, like I said, photos of her a little bit older, we see that the nose has shrunk down. The tip looks like possible tip graft and more tip projection, as well as the nostrils narrowing, bridge being more defined. So those are all telltale signs of a rhinoplasty being done. And again, I think it was done well. I think that it was, adding to her beauty, and so I think it was a good rhinoplasty. One thing that was in the news with her was breast augmentation. Whether you believe she did it or not, I think that she probably did. But again, breasts don't usually, unless you're gaining a lot of weight, naturally just always then get a lot bigger. During that time, we see that she increased her breast size, and most likely due to breast augmentation. And then, interesting with her and someone in general, she decided to take them out probably, because then we see that they shrunk back down again. And again, unless you're doing lifts and different things or huge changes in weight, which she didn't, she's probably had the implants removed. Question is why? I think it's a good point to make because a lot of women, and some men, always think bigger is better. And that's not always true. I think that some women, they don't want to draw too much attention to themselves. So sometimes when they go and get the breast augmentation, they realize, wow, I'm getting a lot more attention than I wanted. And they want to go back, take them out, go smaller. So it's not always that they want to go bigger. And I think that women should realize that too going into the surgery. Don't go too big, stay natural, don't overdo it. Because you have to kind of get used to the increased attention, just changing your body type. One other thing with her is when she did it when she was younger, the good news is if you don't go too big and you want to take them out, then it is pretty easy surgery to remove those breast implants. And you don't need lifts and changes and everything if you hadn't gone too big in the first place. So if we fast forward a little bit now to Meghan in her late 30s, really early 40s, she is aging very gracefully. I think, again, she's doing a very nice job as far as maintaining, not overdoing things. She also has access, like I always say, to great hairstylists and makeup and contouring and everything that's going to make everything just come together very well and look great on camera and in person. I do think she's probably doing a little bit of maintenance, probably touch up again with fillers and a little bit of Botox here and there. Probably not a lot, but just little tweaks with it. Maybe some skincare like microneedling and just normal skincare because her skin's glowing, it's almost flawless. She looks great. I do notice in her lower face that if we look at her younger to a little bit more towards middle age, that her face has definitely been contoured in. And again, that can be due to just normal aging as the buckles kind of naturally come in and give contour to that lower face. And or in her case, the other surgeries that will do that, like I always say, is that if we want to contour that jawline, because she has really strong masseters and lower jawline, you can decrease the masseters with Botox injections to narrow that lower part of the face, as well as buccal lipectomies. If the buckles don't naturally go with age and people who have rounder faces or heavier bottom faces, they can do that to contour the lower face like that. But hers, probably a little bit more just a natural process with aging and that her face is just maturing naturally. Although maybe a little bit of contouring to that jawline, the masseter area, the mandibular areas, maybe is slightly narrow, which won't naturally go away unless something is being done to narrow that. I get this question a lot. There's a lot of photos with her and her mother. And I think it's interesting because her mother's nose shows how the nose changes with aging a little bit. I know she's biracial and it's a little bit different, but in this case we can see how much wider and more bulbous, and the tip tends to drop a little bit with age. Meghan's case, you can see when they're side by side how much more narrow her nose and contoured it is compared to her mother's nose. And I think, again, because she's probably done that rhinoplasty, it won't tend to get as bulbous with aging and age a little bit better and more gracefully. Because people ask me that a lot. Do the noses continue to grow with age? What happens? Is that true? And they do. Like, as the ligaments in the nose weaken and it drops a little bit, and they do tend to get a little bit more bulbous with age. On the flip side, so when you're a little bit older and you shrink your nose, you do tend to look younger. So those are one of the things we do combine with rejuvenation surgery now, doing facelifts, rejuvenating the face, as well as shrinking the nose, because all of it starts to work together to make you not only look younger, but more attractive. So in closing, I think overall Meghan is a very attractive woman. She's done very well. Even though she's done minor tweaks with the plastic surgeries, it's been done very well. She looks very natural, very pretty. So I think as long as, again, she stays on this course and just continues along these lines and stays very natural with minor alterations, I think she's going to continue to age very gracefully into the future.